Hey everyone, welcome to the Slice of Healthcare podcast. I'm your host, Jared Taylor. Today I'm joined by Dr. Mary Mulcare, the Chief Medical Officer at Summus Global. How are you today?
Hi, good. Thank you. Thank you for having me.
Yeah, I'm excited to see you again. You and I first met at the American Telemedicine Association conference in Boston. Geez, it's been almost a month or two now, right? Yeah, about 2 months. Um, time flies. Time flies. But yeah, and you even did one of the teaser videos for us, so people are already going to recognize you from that. But really excited to have you on a full fledged podcast episode, and let's dive right into it. I'd love if you could tell the audience maybe a little bit about your background, and then we'll talk about the company.
Great, sounds good. So as you said, I'm the chief medical officer for Summus, and I've actually known Summus since its inception about 6 years ago. By background, I'm an emergency medicine physician. I'd been practicing for give or take 15 years prior to coming over to Summus full time in New York City at Weill Cornell Medicine. I'd had a fun hybrid career in sort of the clinical space as well as the academic space and the research space, also with a subspecialty in geriatric emergency medicine. So sort of dealing with 80 and up is my wheelhouse of activity in the emergency department. I started with Summus not long after it came to be as one of the Summus MDs, doing initial consults, intakes, and also expert opinions in the geriatric realm. And working with Summus, for a lot of us physicians, sort of reminds us why we went into medicine in the first place. Because you're handed clinical information, essentially handed it on a silver platter, and you get time, literally just one-on-one with patients, getting to educate them, guide them, help them understand different aspects of medicine that can be so complex. And then I was fortunate enough to be able to join Summus about 11 months ago, full time as the chief medical officer.
I'm sure they're super excited to have you. It was so great just being able to get to know you a little bit more at the conference, and it's pretty cool that you also started out with the company originally as one of the initial clinicians, and then moved into this chief medical officer role. So, and then I'm sure that experience has definitely helped you in this role. Is that fair to say?
Oh, definitely. I think it's been an asset having been able to see it from all different angles, and especially as we're you know making decisions, making moves, understanding what works, what doesn't work. I've seen it first and foremost from the user side, which is what allows me to, I think, hopefully make some better decisions in where we go in the future.
Absolutely. Well, if you could tell us a little bit more about the company, maybe give us an overview. I try to follow this format. Don't feel like you have to, but I say, like, tell me the why, how, what, because that's usually how buying decisions end up going. But either way, just if you could give us the 2 3 minute spiel on Sumus Global, and then I know we have a couple topics that you and I wanted to touch base on today.
Sure. So we are the leading virtual specialty care platform, and we're driven by the mission of restoring humanity to medicine and also really broadening people's access to high quality care in a very quick, efficient manner, making sure that people get the answers that they need and really empowering people and their families to make the best healthcare decisions that they can specific to them. Healthcare decisions vary by person, and so it's really important that people are given the information that they need in order to be able to make that decision for themselves and as it best applies in their life. Um, how we do that in a lot of different ways. Most we have both a consumer channel. We work directly also with a lot of major academic medical centers, which I think we're going to get into shortly. And we also work with a lot of large group employers, employers who are self-insured, and we are a layered benefit on top of traditional medical benefits. And so we help, fill in all the gaps that often exist in our healthcare system. We'll take in people who literally need anything in the specialty space, from navigation through it to understanding a new diagnosis, to spending time with patients and our members where they didn't get time to spend with their primary care doctor, understanding their options, understanding what they need, all the way through to expert medical opinions. We have a network of over, at this point, actually now up to about 5,000 experts across the country from the top academic medical centers, numbering over 50 academic medical centers at this point, who work with us doing expert consultations based on what the need is. And we cover every condition, right? So a little bit different from many of the point solutions that exist. We cover anything from allergies to ALS to cancer to, esophageal issues, you name it. It runs the gamut of what we handle.
Interesting. And let's start to go into some of these like key new product launches, some of these partnerships that you were just talking about. So um, I know one of the things that you and I were looking into when we were chatting was you recently launched something called Summus Wellbeing. Uh, can you give us kind of give us a broad overview of what that program entails and how it will benefit current and then let's say prospective Summus members?
Sure. So, Summus Wellbeing through lifestyle medicine is our answer to the wellness conundrum, that has existed, that people have been, sort of trying to tackle for years in various capacities, with plus minus efficacy depending on who you talk to and the different solution included. Um, Summa's Wellbeing, again, it's founded in lifestyle medicine. And you may ask, what is lifestyle medicine? Since a lot of people ask that. And it's a specific subspecialty within medicine that actually focuses on evidence based medicine for preventing, treating, and reversing chronic disease. So it really covers the gamut and is focused in 6 pillars: nutrition, exercise, sleep, stress reduction, avoidance of risky behaviors, and social connectedness. And all these different pillars work together for every one of us in our lives in order to really make us the healthiest us that we can be. And so the other main tenet of lifestyle medicine, which I love and I think is really important for our members, is that the goal of it is to meet somebody where they are, right? So, take nutrition for an example, right? If you come into us looking for guidance in, lifestyle medicine in general, looking to become healthier, and, we really pinpoint nutrition as a place for us to start. If you're starting at a place where you drink 12 regular sodas a day, we can start there, and start to get you healthier from that point. Or if you come in and you are already running marathons, but you just really want to tweak your performance, we can start there. And we've got experts that run the gamut, all diplomats from the American College of Lifestyle Medicine. And we've formed a very strong partnership with the American College of Lifestyle Medicine for, promoting this, providing the educational material, guidance, really getting the word out there that this is a thing and it's here to stay. And hopefully it will help sort of redefine how we think about healthcare in general going forward.
And that's super exciting, by the way, for your team and for your members. So congratulations on that new launch. Um, Now, when we look into kind of new partnerships and those like collaboration relationships, it was pretty cool to learn about one of your new ones being Boston Children's Hospital. Previously, I lived in Boston for a few years, know the area well, and actually, Boston Children's is one of the places that I believe they released a cool handbook, digital health like playbook a while back on like how to scale and things like that before like digital health was even as popular as it is today. Can you talk a little bit more about that collaboration and uh, how you see it impacting virtual pediatric care?
Sure. So you've addressed it right off the bat with the fact that Boston Children is very forward thinking, and they've got a very strong digital health team, and the partnership at Boston Children specifically among their digital health team and their physician team as well as their overall leadership is really incredible and something that can hopefully get emulated across the country going forward. But the point being that they're thinking ahead, right? So our initial use case with them is that we are powering their second opinion program, their remote second opinion program, which is an incredibly strong program. They do second opinions across both domestically across the entire country as well as internationally, and they're really reaching out to help every child that they possibly can everywhere in the world with the rarest of diagnoses. Having been doing this with them for the last month and handling a bunch of the cases and looking through them, like, wow, these are really sick kids. And they're really lucky to have a place like Boston Children that's both able and willing to put their tentacles as far out as they do to provide guidance and education for folks and provide opinions to try and help people get the care that they really need. The future vision of the relationship is constantly evolving, and we're really excited to see where it goes. I think they have much bigger, broader visions virtual care, specifically in the pediatric population. Um, and we're excited to help make it happen with them and really be the technology behind what they're doing and help them power it all.
Well, it's definitely the right relationship there. Like you said, very forward thinking company. For not all the health systems are thinking like Boston Children's, right? And hopefully, we continue to see that thought process like become apparent in these other health systems as well.
Yeah.
In terms of these collaborations, that it's clear to me that you'll be putting together more of these type of relationships. Correct me if I'm wrong. So, in terms of these collaborations and programs, what would you say sets Summus like apart from these other virtual specialty platforms that exist on the market today?
Yeah. I'd say that I think there are two things at the foundation of Sumus that make us different. One is we're tech first. I think we spent a long time building the platform before we put it out there. And we're also physician first, which is a little bit different from the way that, most of healthcare thinks these days. And patients first is not a bad thing by any means. Not to say it is, but physicians, I think a little bit of, especially my mantra, but the company mantra is, happy physician equals productive encounter equals happy patient equals good health outcome, right? So if you can really enable the physicians to get their expertise out there, you're doing a really good thing. And so that's where we're coming from and what we're trying to do. Our platform's incredibly versatile, so it's multidimensional. We can do video, we can do written, we can do async communication. We can do all different kinds of communication with it. And how the platform has been built is very exceedingly user friendly. Members understand it, patients understand it, and most importantly, physicians understand it. Many physicians are a little tech challenged, and I will be the first to say it as a physician. And so having something that's easy to use with all the information right at your fingertips without a bunch of clicks is incredibly powerful.
And last thing I will ask you before we wrap up here is what's next for the company that you can share. I know that's sometimes a tricky question to answer that you're available to share.
Yeah, good question. I think there are a lot of things that are coming next, which is what's so exciting about this. I think one of the things that's very near on the horizon that we're working with a few folks on is, how to best pivot among different communication styles for patients depending on what's needed for them. Not pigeonholing yourself in one specific style, and seamlessly being able to do that. Which is often hard. Um, I have grand aspirations of helping turn the overall healthcare system into more of a preventative model rather than a reactionary model. That's long-term goals in terms of us reaching out to folks, getting lifestyle medicine into the vernacular, and seeing how we can best improve health outcomes going forward.
Well, I really want to thank you, by the way, once again for coming on. Well, first off, for doing the video in person at the ATA conference, and then shout out to the ATA for us being able to meet there. It was a great event, um, and event that you spoke at as well, right?
Yes,
So
yep.
also shout out to them for having you be a part of that.
Yeah, it was,
Uh,
it was a great conference. I really enjoyed it, and they put
it,
together some wonderful panels.
I like that it was in Boston too. It was not bad weather, although it was actually pretty chilly for me being from Florida. But overall, not too bad. But yeah. But again, thank you so much for coming on the podcast today. Super excited that we were able to do this, and hopefully we can have you on again soon to go over some other topics about the space.
Perfect. Be happy to join anytime.